Here they come. Got themselves sorted. Kids watered, plants fed. Oh, good crowd. Good crowd coming in, guys.
Fabulous.
Yep. Okay, crack on when you're ready.
All right. Hello. Good evening, everyone. My name is Deb Ranson. I'm a clinical nurse consultant, and welcome to the 5th episode in our series, brought to you by Derek Pyra and Jason Frost from the veterans group No More Zombie Veterans. Our presenter tonight is Robert Collier. He has presented our previous episodes in this series. You may already know him or of him, but for those of you that don't, that are joining us for the first time, Robert's had a remarkable career in this industry. In fact, over 20 years spanning the globe. He's also an esteemed keynote speaker and an expert consultant in endocannabinoid therapies, genetics, cultivation, and regulatory proficiency. Tonight's topic from Robert is examining and addressing stigma and perception surrounding endocannabinoid therapies, its connection to psychosis, and that historical portrayal of cannabis leading to criminality. The Just Ask Robert YouTube channel is there as well. Please engage with this channel for additional questions, or if you've missed previous episodes in this series, you can jump on there and review those. So a bit of quick housekeeping before we begin. Put your questions in the chat and we will get to them if relevant as soon as we can and after the presentation as well. And just remember as well, guys, that this does not constitute medical advice. Please do seek that guidance from your reputable practitioner. And without further ado, I'll introduce you to Robert tonight. So welcome, Robert. Let's get started. Fantastic. Thank you.
Thank you for the introduction, as always, Deb. And as we said, we're here thanks to No More Zombie Veterans. So, look, good evening, everyone. Thank you for joining us this evening to discuss an important topic, which has garnered increased attention and debate: the stigma surrounding endocannabinoid therapies, psychosis, and perception. Right. As we delve into this subject, it is crucial to approach it with an open mind, grounded in both scientific evidence and compassionate understanding. The stigma around endocannabinoid therapies largely stems from the broader social views on cannabinoids. Throughout much of the 20th century, cannabinoids were associated with criminality, addiction, and deviant behavior. The War on Drugs campaign further demonized cannabinoid use, leading to widespread misconceptions and fears. The negative perceptions were compounded by the lack of scientific understanding and research, as cannabinoids were classified as a Schedule I drug, indicating it had no scientific, medical, or potential use. This classification severely restricted scientific studies, perpetuating ignorance and stigma. Despite growing evidence of the therapeutic benefits of cannabinoids, stigma persists. The stigma manifests itself in several ways. Sorry to pause for a second. Is the slideshow working? There we go.
Just a better screen. Sorry, Robert.
No, you're all good. You're all good. But when we first started with, public perception. Many people still view cannabinoids and its derivatives solely as recreational drugs, rather than their potential for medical treatments. This perception is often reinforced by media portrayals that focus on the drug's illegal and recreational use, rather than its medical applications. When we look at an awful lot of the context that does be kind of pushed forward in the media, it very, very seldom has a positive spin on it. it usually has something along the lines of cannabinoids cause this or medical cannabis causes that. And it's not exactly always in the realm as to what should be actually pushed forward or what's really best for the public knowledge. The second thing that we look at is the healthcare hesitancy. Patients who might benefit from endocannabinoid therapies are often reluctant to discuss them with their healthcare providers due to fear of judgment or legal repercussions. This hesitancy can lead to untreated or inadequate managed conditions. So some people, with regards to the job that they have, it might be a no-no for them to be able to consume different types of cannabinoid medication. So the initial fear of even beginning to discuss it is something that's that's not even possible for some individuals. The next area is regulatory and legal barriers. Many regions still have strict regulations that limit the availability and research of cannabinoid therapies. This not only hinders access for patients, but also stifles further scientific investigation, and which could alleviate concerns and broaden acceptance. Like, as we all know, like, our policymakers don't always make the right choice when it comes to cannabinoids and cannabinoid therapies. And an awful lot of this can cause some myths to be continued around cannabinoid therapies that really can only be got rid of through proper scientific study and open acceptance. Another large area is professional skepticism. Among many medical professionals, there is often skepticism or outright rejection of cannabinoid therapies due to the lack of comprehensive education on the endocannabinoid system and the benefits of these treatments. This professional bias can prevent the integration of cannabinoid therapies into mainstream medical practice. Without doctors being given the right information, as well as many decades of false and misleading information being provided, professionals, they take a bit of a slower approach around to actually accepting it. When they've been told for so long it was incorrect, to all of a sudden being told it is available, that is not something that can happen overnight. It does actually take time. To effectively address and reduce the stigma around endocannabinoid therapies, we need a comprehensive, multifaceted approach. The number one area that we look into that is education and awareness. Education is the cornerstone of changing perceptions. Both the public and the healthcare professionals need accurate, scientific-based information about the endocannabinoid system and the therapeutic potential of cannabinoids. We need public health campaigns that inform about the legitimate medical uses of cannabinoids, dispel myths, and humanize patients who use these therapies. The next area is professional training for medical and nursing schools. Should incorporate comprehensive education on the endocannabinoid system and cannabinoid therapies into their curriculum. Continuing education programs should be available for current practitioners, and according as new information comes about, it should be provided free and openly to all prescribers and doctors that are operating in this area. The next area that we look at is policy and regulation. Advocacy for policy change is crucial. This involves, number one, reclassification, pushing for the reclassification of cannabinoids to facilitate research and acknowledge its medical potential. And number two, legal reforms, advocating for laws that protect patients who use cannabinoid therapies and ensure they are safe and have legal access to these medications. When it comes to removing stigma, the next area we need to look at is for the research and the evidence. Expanding research is vital to building a robust evidence base that can inform practice and policy. This includes, number one, as we all know, is funding. Increased funding for research on cannabinoid therapies, including clinical trials and long-term studies to understand its efficacy and its safety. Number two is collaboration. Encouraging collaboration between researchers, healthcare providers, and policymakers leads to translate findings into practice and policy effectively. The next area that we look into, of course, is for patient advocacy and support. Empowering patients is absolutely essential for reducing stigma and ensuring access to necessary treatments. Support groups. Establishing support groups for patients using cannabinoid therapies to share experiences and advocate collectively for their rights and needs. And while also paying a lot of attention to actual patient stories, highlighting patient stories and testimonies to humanize the issue and demonstrate the real-world benefits of these therapies. The journey towards destigmatizing endocannabinoid therapy is not an easy one. There's been a lot of misinformation traveling around for a long time, but it is most definitely a necessary and worthy endeavor. By embracing education, advocating for policy change, supporting robust research, and empowering patients, we can change a narrative around cannabinoid therapies. As we move forward, it's crucial that we remember that the heart of this issue are individuals seeking relief, dignity, and a better quality of life. It is our responsibility as informed citizens and compassionate human beings to support and advocate for those in need. Together, we can remove the stigma and pave a way for the future where endocannabinoid therapies are recognized and respected for their true potential. The next area we're going to touch on is psychosis. When we look at psychosis as a mental health condition, it is characterized by a disconnection from reality, which can manifest as hallucinations, delusions, and impaired thinking. It is a symptom rather than a diagnosis and can occur in conditions like schizophrenia, bipolar disorder, and severe depression. Understanding the how should we say it? The mechanisms of psychosis is crucial for developing effective treatments. The intersection of cannabinoids and psychosis. Right? When we kind of look at the historically, cannabinoids has been associated with the therapeutic and adverse effects on mental health. The primary psychoactive component of cannabinoid therapies is THC, which is being implicated in a lot of psychotic symptoms, particularly in high doses or among individuals disposed to mental health conditions. This association has fueled concerns and stigmatization of cannabinoids and cannabinoids therapies, and by extension, cannabinoid therapies and its derivatives. When we look at the current research and evidence, clinical studies have been conducted in this area. Like, for a start, we look at the antipsychotic potential of CBD. A landmark study published in the American Journal of Psychiatry found that the CBD significantly reduced psychotic symptoms in patients with schizophrenia compared to a placebo. The patients tolerated CBD well with minimum side effects. The CBD is believed to interact with the endocannabinoid system in a way that modulates neurotransmitter systems implicated in psychosis, such as dopamine and serotonin. Unlike THC, CBD does not bind strongly to the cannabinoid receptors, which may explain its lack of psychoactive effects and its potential therapeutic benefits. When we look at neuroimaging studies, have provided insights as to how exactly CBD affects brain function. Research using MRIs has shown that CBD can normalize dysfunctional brain activity in regions associated with psychosis, such as the prefrontal cortex and the hippocampus. Now, there's always challenging controversies as to when we look into cannabinoids and psychosis. As to some people and some prescribers are very cautious around what can be prescribed to people who have had a history of whether it be schizophrenia or bipolar or even anxiety in some cases. Not all patients respond to CBD and cannabinoids in the same way. Factors such as dosage, duration of treatment, and individual differences in the endocannabinoid system can influence outcomes. There's also the potential for THC to possibly exuberate the psychosis. It remains a significant area of concern and a significant area of study. This underscores the need for careful regulation and study, and as well as monitoring and long-term trials to see exactly as to what is effective and what isn't. There then, in this area, there becomes a lot of legal barriers as it arises. Like when we look at research conditions, like in many places, strict regulations on cannabinoid research impede the ability to conduct large-scale, rigorous clinical trials. Then legal barriers can also restrict patient access to potential beneficial treatments, leading to disparities in care. So while a lot of people might want to see as to what can be effective for in the realm of psychosis, there's a lot of areas which do not allow that to happen. When we look then at the future directions that we're trying to push this in, we need to look at exactly as to how we can make this more effective. So more extensive multi-center clinical trials are needed to confirm the efficacy and safety of cannabinoids for psychosis. Studies are essential to understand the long-term effects and potential risks of endocannabinoid therapies that we are doing for patients that do have psychosis or have a history of psychosis. While also working with an individual, it can be a personalized medication. So recognizing how the patients respond to different cannabinoids, personalized approaches could optimize treatment outcomes. This involves identifying biomarkers that can predict responses to cannabinoid therapies. Policy and advocacy in this area is always a little bit of a touchy subject. Advocating for changes in cannabinoid regulation to facilitate research into psychosis are usually a couple of the ones that take the longest length of time to happen. And educating healthcare professionals about the endocannabinoid system and cannabinoid therapies to reduce stigma and improve clinical practices is not always the easiest thing to do. But that's the areas we need to be pushing forward into. So when we look at the intersection of cannabinoid therapies and psychosis, it represents a promising yet complex frontier in mental health treatment. While the potential benefits of cannabinoids like CBD offer hope, we must navigate these very carefully and ensure that we do it right. So it's not just a scenario where one size fits all. It is a look into as to how exactly this needs to be dealt with so we can at least provide patients with the proper medications that they require to deal with whatever they need to deal with. It's important that we embrace the scientific inquiry and fostering open-minded dialogue, and we pave a way for innovative treatments that enhance mental health and well-being. The next area that we're going to look into is the criminality that has always essentially been associated with endocannabinoids and its uses. This topic has profound implications for both public health and social justice. The historical link between endocannabinoid therapies and criminality, understanding this connection requires us to delve into the history of cannabinoids, its therapeutic potential, and the socio-political factors that have shaped public perception and policy. Cannabinoids have been used for thousands of years across different cultures. For its medical properties, the ancient Chinese texts referred to cannabinoids as a remedy for ailments like rheumatism and malaria. In India, it is being used for medicine for pain relief and digestive issues. These historical uses highlight a long-standing recognition of cannabinoids' therapeutic potential. When we start to look at the West, cannabinoid therapies entering Western medicine in the 19th century, where it was used to treat conditions such as migraines, pain, and insomnia. Its popularity grew as physicians observed its efficacy and relatively low side effect profile compared to other available treatments. Then we started going into the 20th century. And this is when things started to change drastically. The turn of the 20th century marked a dramatic shift in the perception of endocannabinoid therapies, influenced by several socio-political factors. Number one was racial prejudice. In the United States, we start there, the Mexican Revolution led to an increased Mexican migration, and with it, the so-called recreational use of cannabinoids. This association fostered, how should we put it, racial prejudices. Yeah, as cannabinoids became linked with Mexican immigrants and African Americans who are often portrayed negatively in the media. Economic interests at the time, the pharmaceutical industry saw cannabinoid therapies, a plant that could be easily growing, as a threat to its own synthetic drugs. This economic interest contributed to lobbying for stricter cannabinoid regulations. Then we move on to the war on drugs era. The most significant shift in the war on drugs was initiated in the 1970s under President Richard Nixon. Cannabinoids and cannabinoid therapies were classified as a Schedule I drug under the Controlled Substances Act of 1970, indicating that it had no actual or acceptable medical use and quite a high potential for abuse. This classification severely restricted research and fueled a campaign that linked cannabinoids with criminality, addiction, and social decay. Now, when we started to look at what was the impact of that criminalization, we had social and racial injustice. Criminalization of cannabinoids had devastating effects on community, particularly marginalized ones. mass incarceration. The war on drugs led to skyrocketing incarceration rates, disproportionately affecting African American and Latino communities. Despite similar rates of usage among different racial groups, minorities were arrested and convicted at much higher rates. Criminal records for cannabinoid and endocannabinoid therapy related offences hindered individuals' opportunities for employment, education, housing, and they perpetuate a cycle of poverty and disenfranchisement. This also led to a huge hindrance to medical research. The legal barriers surrounding cannabinoids and cannabinoid research was severely limited. Like, when we look at something that is put into a Schedule 1 classification, made it extremely difficult for researchers to, number one, obtain it for studies, leading to a huge gap in our understanding of its therapeutic properties and of its risks. Patients who might have benefited from cannabinoid-based treatments were denied access. You can't have it, you can't use it, it has no benefit, and don't mention it again. Well, there's usually a lot of things as to what people were hearing. Like, a lot of these a lot of this then led to prolonged suffering and reliance on less effective, more harmful medications. Like, then when we look as to how the next section is the path to reevaluation and reform, right? So over the past few decades, there's been a shift. There's been a growing movement to reevaluate the legal and social status of endocannabinoid therapies. Many countries have enacted laws permitting the medical use of cannabinoids, recognizing its potential to treat conditions like chronic pain, epilepsy, multiple sclerosis, just to name a few. Right? Then we got decriminalization and legalization. While some jurisdictions have moved towards decriminalization or even fully legalizing medical cannabis like we have here in Australia, these changes reflect a much broader shift towards viewing endocannabinoid therapies through rather of a public health lens rather than it having no initial benefit. Now, there's still a long way to go. While we may have in place, how should we put it, the laws and rules and regulations around how we are prescribed medical cannabis, as to how we receive it, as to how we have to consume it, we're still not completely protected there. Like, for instance, if we are to look at, still some of the criminology that's behind cannabinoids, if we look at the driving laws that exist, like we can look at them in Europe, we can look at them in Australia, and I happen to know a little bit about this kind of subject myself. Whether somebody is actually prescribed medicinal or endocannabinoid therapies, they're still not covered by the law. So if they go along and they consume it and they get in their car and drive, while they may not be feeling the effects of it, it is still possible for it to be detected in the system. Now, when you're looking at it, this can possibly still be tested to be positive, whether it be a day after or nearly 24 hours or 36 hours afterwards. Everybody is different as to how long it might remain in one person's system, as to how long it might remain in another person's system, completely change. So even though there has been a lot of change happening, people that are prescribed it and are receiving it legally and using it according to their prescribed conditions and what way they should be taking it, they can still lose their job, lose their license, and that can then put the same sort of stresses that we've been talking about for the last 100 years on people. So you have a family man, he works, and then all of a sudden he goes home in the evening. It could be a high impact job, so that he uses a cannabinoid therapy to treat himself. And then one evening he's coming home, there's a police checkpoint, and that person is swabbed. He comes back as positive. He shows that he is actually a prescribed patient. He shows that he has everything in order. Doesn't mean anything. Like, you have to look on it. It's a little bit funny when you're kind of going, well, it's been signed off as a legitimate medication. It's been signed off to be effective. And you still can lose your job over it if it's detected in your system. Now, we all understand this the exact same way. With regards, I understand it if somebody is under the influence of alcohol and they get into their car and drive. That can be very detrimental to themselves and to anybody else that they could have an accident with. And we understand exactly. It's hence why in many locations around the world, the laws in place are that, yeah, it's not to be consumed about 4 hours before you actually drive a vehicle. And if somebody feels like they're having the effects, they're not to consume or try, they're not to consume anymore, and they're not to be driving a vehicle. But here, it doesn't matter. Even if they don't feel the effects of it, and they do feel that they're perfectly fine, they can still get into their car, drive to work like any proper law-abiding citizen, and then find themselves that they've lost their job, they've lost their car, they've lost their license, and that could lead then to a lot more devastation. So there's still a lot that has to change, and especially when it comes to those driving laws, considering the fact that there's lots of other medications that people can be prescribed, which can have a much more drastic effect on your competency to operate a motor propelled vehicle. So yeah, we're looking at the moment in Australia as to how that can be changed. But no matter what, looks like that we're still all going to be in a scenario where we're possibly breaking the law if we do consume our cannabinoid medication and decide to drive, whether it be that night or whether it be the next day. I think that does have to change, and does have to change a lot quicker than what it is happening. Now, when we're looking then at other advancements in research to support what we're talking about, like recent trials have shown that cannabinoids, they don't necessarily have prolonged effects. So you're not really going to be feeling them for 8, 12 hours after they have been consumed. So all of that information needs to be put together when we are talking about politicians that make the legislation, as well as the policymakers that enforce it. Right. The future of endocannabinoid therapies and social justice. As we move forward, it is crucial to integrate the therapeutic potential of cannabinoids with a commitment to social justice. Many states that have legalized endocannabinoids are implementing policies to expunge the records of those convicted of cannabinoid-related offenses, helping to rectify past injustices. Like a lot of people that were involved in cannabinoid production and that, a lot of those people were doing it for the right reasons. A lot of those people had their lives completely destroyed for it. And there should be a lot of elements that kind of goes, wait 1 second here now. Let's look back and see as to where society could have got it wrong. And let's see what they can do to actually rectify those problems. As I said, there's still some people that are, and you've got scenarios where you've got cannabinoids being openly sold, and you've still got people in jail all of this time later. Like, it has to be looked at that there's definitely something wrong there, and it needs to be resolved. as to what exactly is an approach to this, I don't have an answer for that right now. So, but I do know is that if the only thing that somebody has ever done in their life is produce cannabinoids, why should they have a criminal history for it? If it's now being moved forward and we're seeing the potential benefits of it, why do we still have people like suffering from it or actually having their lives torn apart because of it? It's just really, like, when you think about it, it makes no sense. Like, it's it's crazy. So, on saying that, my conclusion on the criminality of it, the historical link between endocannabinoid therapies and criminality is really complex. Yeah, it's got some fascinating stories and some fascinating people. And if it wasn't for people pushing this forward, even though everything around them told them it was wrong and it was incorrect, and we're going to take away your life, and we're going to lock you up, and we're going to let you see your kids, and we're not going to let you see your families, like, you got to give it to those people. Like I said, they get to, because of those people, this is the why everybody else gets to play. And when you look upon as well, like the criminality of it, I kind of go, well, really, now considering the fact is that some of the people that have kind of come into the medical or endocannabinoid space are probably some of the biggest criminals now that have existed. So when you look at as to some situations where products that are produced, products that are shipped out to patients, as to how they are treated and the rest of it, you can clearly see that these people should, number one, have never been allowed in the industry. And there's now a whole new criminality area involved in endocannabinoid therapies and cannabinoids that really needs to be looked at. Like, why should anymore? It's like, oh, this person grew it and he shouldn't have grown it. Well, what about for individuals that are growing products or providing products that are not safe or don't pass the right quality or tests or really shouldn't be given for any human consumption? Look, these areas need to be properly looked at. Like, a lot of the people that would have been the first ones to pick up the phone to report people, a lot of them now, accountants and bankers and the rest of it, they're now involved in this business. So it needs to be kind of looked upon as to, there's a lot of social injustices that have happened in the past, and as to what we're going to do to make sure that those don't happen into the future, and that people are actually recognized for what they've done, and we get the laws changed and people expunged for what should be done. So upon saying that, I'm going to leave it on that for this evening. And now we will look at whatever questions we have available. Or if, Deb, you have any areas you'd like to add to, please do.
Yeah, thanks so much, Robert. Excuse me. I hope you all found that interesting and eye-opening. I believe the stigma is very wide, very real. I experience it every day in my consults, just in feedback with patients, but it's very real. And just to touch on what Robert said there, green market patients, or that black market area, I say, from years ago, if it wasn't from all those guys fighting and speaking up to their practitioners over the last 20 odd years, we wouldn't have been able to evolve in 2016 and have that legislation change. It was those patients that actually were self-treating, I guess you'd say, on the green market, so they're the pioneers. That's what I call them. They were the pioneers of this, not the cannabis companies that are held, in great esteem for what they do. It was the patients that pushed it through to enable those companies to do what they do. And it's really funny when we touch on THC, we all know that the regions of your brain that THC acts on to make you calm and that euphoric or that high feeling, they're the same areas that can flip the switch and send you into a freak out mode. So, when it comes to THC, that emotional, I guess, state of your brain, that experience is really much dependent on how much THC is in your system. Even when you're not consuming THC, there are parts of your brain that are constantly communicating to decide if you're in danger. The amygdala, the hippocampus, what Robert touched on before, that prefrontal cortex, together, we know those cerebral sections are sometimes known as that fear circuit. Is that psychosis? I don't know. I just think it's dose dependent. There's areas of psychosis that, are true and relevant. But, was that caused by cannabis? So anyway, thanks very much, Robert. I could rave on all night, a bit of a plant rant, but I have come to...
Yeah, we have some time, so we're in no hurry for it. We have a few minutes to discuss this area, Deb, so please keep talking.
Well, really at the end of the day, I think that there's just so many different theories out there and so many different people's opinions. You just need to base it back to the education, go back to the science. The theories and thoughts and perceptions out there are great. At best, you're going to get some real parts to it, lots of anecdotal, but there is science out there, So in my humble opinion, I reckon that practitioners and patients alike just seek out that in-depth knowledge. Find those. If you're a patient, then seek that in-depth practitioner, someone who understands not only what products are out there, because there's thousands available to patients. You do not need to be told you need to stick with a certain product from a certain company. If it's not working for you, advocate for yourself. There's been a lot of stuff in the news lately that does happen. I don't know if people have seen it. It does happen, but there's a lot of quality practitioners out there. So I would say, seek them out, advocate for yourself, seek a second opinion if it's based on stigma, and get that second opinion. There's not much else you can do. You've got the feet, just walk, use them to walk out and find someone. There's so much information available to not only practitioners with webinars like what we do here, nurses and doctors and practitioners. They all have their own groups out there that are really in-depth, knowledgeable practitioners that are sharing what they've learned just in the last, 8 years now. And I can't believe 8 years on, we're so deep in stigma, like Drive Change. I myself am an ambassador for Drive Change. Any of you that feel really, really strongly about this driving law, get on board, become an ambassador if you're a company out there and it affects you directly. It's your products that you're trying to aim at these medical conditions and these patients and get them over the line to some quality health. And then they get there and they can't drive. So as a company, I say to those people, put some money behind Drive Change and things like that. Speak to it. But
well, look, if there's one thing we know, nothing ever changes without money. And that's it. So yeah, the only way you're ever going to get that policy change put into place that we so deserve and we need is, number one, we need good people fighting it, and it needs to be paid for. Simple as that. And there's nothing that happens through government. There's no laws that get pushed into place without some sort of funding behind it. And usually it's not the sort of funding that people like us are able to provide. So it's like, because even when I look at us, go back 20 years ago, back in Holland, when we were looking to try and do trials and studies and the rest of it, like, sure, we had lots of things as, hey, if you can show us what is a negative effect of cannabinoid therapies, we have no problems giving you funding to do that. But to go look for funding to actually do a very independent trial, that was very, very, very difficult. That's why there's not as many trials done as there should have been. It's sad. And it's look, to me, I'm just so glad as to how now there is an awful lot of more openness. A lot more needs to happen. And as I said, the only way we're ever going to change that is through education.
Exactly. Practitioner mainly. I mean, we can get to the patients, but then they see that wall. So we've got to go back to the practitioners, and which is why we're trying to actually get the endocannabinoid system in the curriculum. So if we start at the bottom of the tree and work our way up to the leaves, why are we jumping in the river and fishing people out? Why aren't we up at the top where they're falling in and find out why they're falling in? That to me makes sense. A couple of questions. One, for patients who are taking capsules to bypass roadside saliva tests, should doctors be trained to give guidance on self-impairment testing prior to driving? I got a clear answer for that. There is no legal driving within Australia unless you're in Tasmania with THC in your system. But I do, those gel capsules, sure, they work good to circumvent that oral. It's not going to sit in your mucous membranes or, that oral process. It will go through to the stomach. But remember, then they've got insurance. If they actually, God forbid, they did have a big, large crash where they're unconscious, they're taken to hospital and they're blood tested for toxins straight away, for those drugs. So as a doctor, to be trained and given guidance on self-impairment, it's not legal, yes, everywhere. So that's a bit of a grey area. But what I would say to that GP is, do you give that self-impairment guidance on driving when you prescribe the Valium, when you prescribe the morphine, when you prescribe the methadone, when you send them off to the pharmacy for those other meds? Are you really, full on about that training there? So it's the same drug, if you want to call it a drug. It might be a plant therapy, but it's an S8, S4. So you would do the same education around that as if you'd just given a lady who's got really heavy anxiety, tossing and turning, tried many other therapies, and you've decided to give her a Valium. Then you would go through that education. You may feel a little bit hungover of the morning, that the little bit of brain fog. Take your time. Please don't drive if you're impaired. It's self-monitoring. We self-monitor alcohol. We stop at 0.5. There is no level for cannabis. So let's just say a patient is just as capable of saying, hey, I can't drive because I've had my THC. I feel a bit impaired, as to, hey, I've had 2 endone. I really shouldn't get in the car. So a little bit of too many words there, but that's the answer, really. It goes back to an S4, S8 education. Don't drive if you're impaired. It's no different because it's cannabis. I don't know what you've got to add to that, Rob.
Well, the only thing I've got to add to that is it's, once again, it comes back to the stigma around cannabinoid therapies, that because people are actually on a cannabinoid-based medication, it's looked upon differently.
Exactly, and we've got to remove that. We've got to stop thinking cannabis. We've got to, like, in some consults, I'll say when I'm speaking with patients, and they may only be on a little CBD dose, or they may be on a high THC dose of any particular product, and they don't understand the process of coming back regularly for a follow-up when they're basically telling me the same things. No medication changes, no issues. It's really working well. I'm sleeping well on 2 drops of this, and I'm doing really well with my anxiety. And you have to reiterate, it's an S4, it's an S8, it's a scheduled medication, sits in the same category as morphine. And a lot of them are like, wow, it's cannabis. That's there's so many different theories and perceptions around it. I don't understand why, we can have I've recently experienced a very, very experienced geriatrician giving us talk, and he had a lot of cannabis patients, elderly patients over 75, who were all on cannabis, and he said he'd found so many benefits with them: decreased medications, less falls. And a general practitioner in the audience stood up and sort of said, well, don't you feel, what are you doing about their impairment? What about increased accidents and driving? And he's like, well, what about the morphine and the OxyContin and the pregabalin and everything you prescribe? So it's the same thing, really. You've just got to take away cannabis and think S4, S8, education around that. There is one around a recording. I believe Jackie's going to load the rest of the episodes. Bob's just saying you can only find episode 1 and 2 on Just Ask Robert. I believe the rest will be loaded really quickly this evening. Is that correct?
Yes. So pretty much we should have them up by tonight or tomorrow, all going well.
Yeah. And just a comment from Derek, who actually runs or co-runs Zombie Veterans. He was stuck on a lot of heavy psych meds. As you can see there, you can see his history. It's public everywhere. And to look at Derek today, you would not recognize this man as the same man. And his stigma is driving right now, or trying to establish quality of life, getting around the community on his medicine. He's legally scripted, but still has those issues, and to look at the balloon of Derek back then to how he is now off pharmaceuticals and on his meds, those benefits far outweigh a cannabis patient legally driving off to work or to the doctors or to the gym or to pick up the kids, as opposed to, I'm taking 400 milligrams of tramadol, like the truck driver just recently in Queensland, who everyone would see the news, who actually killed 10 people and maimed 4, and admittedly, openly said, I took 400 milligrams of this medication before I set off to transport these people as a heavy commercial driver. I'm not slagging him off. He was given those pills for chronic pain and had to self-manage that. So there was some impairment there. So why are we different? Why are our cannabis patients treated different? The answer is stigma, and that's what we need to change by advocacy groups, education, practitioners talking and feeding back and that type of thing. And of course, the research that we're seeing going on at the moment. And I think that's for all the questions, guys. Is there anything else before we let you go? We're nearly up to time. Can't see any jumping through. Anything you'd like to add, Robert, before we close for the night?
Well, no, I think, like I said, unless somebody has some more questions, I think that that's me.
Yeah. Well, as Derek just said, 1,200 milligrams of Seroquel daily, and he was a zombie, and he was apparently still legal to drive. So that's, thank you anyway for joining us tonight. Remember, our next webinar is at June the 18th. It's a future trends in Australian therapy. And also, please do remember that this does not constitute to medical advice. Please do seek guidance from your practitioner. Please reach out if anyone wants to chat to any of us. And you can see all of those other episodes there on Just Ask Robert. So have a great night, everybody. Thank you very much for joining us. Stay warm in this upcoming cold weather, and we will chat to you next month at our next episode. Thank you.
Thank you. Bye-bye.
Bye-bye.